created this information video as a guide so you understand what to expect in the lead up to your surgery. Your surgeon will have informed you that you're on the waiting list for elective surgery at the Fitzwilliam Hospital. Whilst you're waiting for surgery, it's a great opportunity to prepare yourself and ensure that you are as healthy as possible. You can do this by ensuring you attend reviews with your GP. If you have a long-term condition such as diabetes or COPD, then please ensure you have had a medication review and any recent blood tests. This will help us to ensure that you are fit to proceed. The next step is that you'll be contacted by a member of the bookings team to give you a date for your procedure. Once you have a date, you'll be invited to attend one of the pre-operative assessment clinics. During your pre-assessment, you'll be reviewed by one of the specialist pre-assessment nurses. You'll be asked questions about your general health, medical history, and any current medications. We will then perform any required tests, which usually include blood tests, MRSA swabs, and an ECG, which is a tracing of your heart. It is sometimes necessary for us to organise an anaesthetic review as part of your pre-assessment, which may result in you needing more specialist investigations. This is nothing to worry about. It is also important, if you've been listed for either a hip, knee or spinal procedure, that you complete something called a patient reportable outcome, and also it's important that you complete a National Joint Registry form. Spinal consent is also something that will be discussed with you separately.
Prior to admission, you would probably have been taking regular pain relief, and we recognise that there may be concerns about pain management during your hospital stay. Our commitment in pharmacy is to reassess your needs after surgery and provide a personalised analgesic regime. Our commitment is to always prioritise your pain management to ensure a smooth and supported recovery process.
My name is Ivan Vidakovic. I'm a spinal consultant surgeon. I've been working with Ramsey for 4 years now. Ideally, patient would need to be fit and well. We of course can accept patients who have diabetes and high blood pressure because these illnesses are well controlled these days. We would ideally recommend our patients to have healthy BMI as well as to try to exercise before the surgery because they are going to have much better outcome then. If we do ACDF surgery, which is cervical anterior decompression fusion, we will go from the left, then make incision on the neck, then move throat one side, vessels other side, and approach the spine from the front. If we do lumbar decompression or lumbar fusion surgery, incision would be at the back of the patient's lower back. We stitch from the inside all the tissues and even the skin, so patients wouldn't have outside stitches to be removed, so they can just remove the dressing on the neck after a week's time, on the lower back after 2 weeks' time. Most often patients stay overnight. If we do microdiscectomy or simple decompression, patients can go home the same day. If we do ACDF, which is cervical decompression fusion, or if we do lumbar fusions, patients in average stay over the night. The best way forward would be to take regular painkillers as per advice. Second thing would be to keep chronic illnesses under the control. Third thing that I would strongly recommend is to attend physiotherapy appointment.
The first step is preparing for your surgery. This helps increase the success, as well as having an effective rehabilitation process. It is very important to do your pre-op exercises. Post-operatively, it is important to complete your physiotherapy exercises, which you will be shown. These are essential for an effective rehabilitation process.